As the leaves start to change and back to school season is in full swing, germs are continuing to spread. Local health officials say flu season estimates and severity look to be similar to years past, but regardless, it's important to protect yourself now.
Fever, coughing, sore throat, fatigue, body aches, all just a few symptoms of the flu.
If you're concerned and you feel suspicious and you want a second opinion or to be looked at, it never hurts to seek, medical attention.
Dr. Stephen Woodall practices at Riverside Primary Care Midtown in Williamsburg and says they aren't seeing too many cases of the flu just yet, but recommends getting vaccinated now.
We recommend getting vaccinated between September and October. Any time's better than no time, really, though. It reduces the rate by about 50%, and it also reduces the severity of infection if you were to get it. And I know a lot of people kind of scoff, oh, it's only 50% effective, but you can imagine when you're dealing with millions of people, 50% can go a long way.
Dr. Woodall says they do usually see a surge during back-to-school time since kids are mingling together again. He says normally they're just passing around viral illnesses because unless the patient is tested, they can't say it's the flu.
Without a formal test, you can't say whether it's one type of virus or the other. If they have general viral symptoms, you can definitely have your assumptions, but unless you get the actual flu test and come back positive, you can kind of just say it looks like a viral illness at this point.
Dr. Woodall says in order to make projections about what we could see this fall, they look at the southern hemisphere to see what they're seeing. That's why health officials believe our flu season could be similar to what we've seen in years past. Dr. Woodall says in addition to the vaccine, there's other ways you can protect yourself too.
Other things that you can do outside of the vaccine are, just good hand hygiene. So washing your hands, not touching your mouth or anything like that. If you cough in your elbow, or wear a mask if you're concerned.
And Dr. Woodall told us that you can get the COVID and flu vaccines together, but you must wait a week to get the RSV vaccine. Riverside has a blog post that breaks down the timing of when to get each vaccine, and we'll link that inside this story on wavy.com.